Tonight, Missouri is one step closer to having a prescription drug monitoring program. Today, a bill called the Narcotics Control Act passed through a select House committee, which, of course, that means now it'll go on to the full House.
ABC 17's Lindsey Burning talked to lawmakers about this bill today. And Lindsey, Missouri is the only state in the country without such a program.
It is, Marissa, and other lawmakers have tried passing similar bills in previous legislative sessions, but those bills have always failed. Representative Holly Rader, the sponsor of the Narcotics Control Act, tells me she thinks the bill has a chance of passing this session because of the change in Senate leadership and an increased awareness in the growing heroin and opioid epidemic. The Centers for Disease Control and Prevention says since 2000, the rate of deaths from drug overdoses has increased 137% in the U.S. In 2014, nearly 1,100 people died in Missouri from drug overdoses.
We have this epidemic across America where you have 3 out of 4 heroin users all started from prescription drug abuse.
House Bill 1892, or the Narcotics Control Act, would require the Department of Health and Senior Services to create a program to monitor prescription drugs. Under the bill, Missouri pharmacists would have to submit information into a database within 7 days of filling a prescription. Last week, U.S. Senator Claire McCaskill held a field hearing in Jefferson City to highlight the opioid epidemic.
We're the outlier here. Common sense tells me if there's 49 states on one side and 1 on the other, I think we're the ones that have it wrong.
But not everyone is in support of the bill. Senator Rob Schaaf, who's also a doctor, has voiced opposition of the bill along with similar bills in past sessions. In 2012, Schaaf said, quote, "The people don't want the government tracking what medications they're taking. That is private information that should stay between a patient and a doctor." But Representative Holly Rader says the bill wouldn't violate Missourians' privacy.
This is no more invasive than electronic medical records. Everyone on Missouri's Medicaid system has been in a similar database, and there's never been a problem.
Representative Rader says if the bill is passed, it could help doctors spot early addiction habits and address them. Tuesday, Senator Schaaf pre-filed a bill that would also establish a prescription drug monitoring program, but doctors and pharmacists would not be able to see the medication list in the database.
Thanks, Lindsey. Representative Rader says the bill could go to the House floor as soon as next week.